In episode 1, we discussed questions necessary to measure pregnancy-related and maternal mortality from census data. In this episode, we will discuss common problems during data collection for these questions and how to avoid them. We will first discuss common problems during data collection for census questions on household deaths, including pregnancy-related deaths. We will then discuss common problems with fertility questions, including children ever born and last child born alive. We will then discuss ways to minimize these errors. Some common problems that happen during data collection are not asking the questions about deaths, skipping the pregnancy-related mortality questions, use of incorrect reference period for deaths, not using the correct definition of household members, incorrect recording of age at death, omitting deaths of women whose pregnancy that did not result in a live birth when asking about the postpartum period. Respondent unable to complete questionnaire due to anger or grief expressed towards the census taker. We will discuss each of these problems and some suggestions for how to minimize these problems. There are many ways to avoid errors during data collection. Some common ways include making sure that the questionnaire is designed well so that the census takers do not skip the section on mortality. Training the census takers is also important to make sure they ask the questions and ask them correctly and in a sensitive way. Fieldwork supervision can also improve errors during data collection. For more recommendations on how to avoid common data collection errors, please refer to the brief on select topics in international censuses measuring maternal mortality found on our website. You will find a link on our course website. Now we will discuss the common problems in collecting data on fertility. As you may recall, there are two types of questions asked on fertility: questions on last child born alive and questions on children ever born. Some common errors for questions on last child born alive are not asking the fertility questions to all women who are supposed to be asked the questions. For example, never married, widowed, divorced, or separated women, older women, or young women, age misreporting of the mother or child, and inaccurate date of birth of last child born alive. Some common problems with the question on children ever born are omitting some children from the total number of children ever born who should be included, erroneously including non-biological children or non-live births to the total number of children ever born. For example, stepchildren, adopted children, other children in the household, stillbirths, or other fetal deaths. Another problem is recording childless women as having no response. The number of births of childless women should be recorded as 0. Census takers instead may erroneously write in dash or leave the response blank. Some common ways to avoid errors during data collection for the fertility questions are questionnaire design, making sure that the questions are asked to all women who are supposed to be asked the questions. Adding some simple consistency checks in the questionnaire may also help avoid errors, such as making sure that the number of boys ever born and number of girls ever born add up to the total number of children ever born. And last but not least, make sure that the census takers are trained adequately. For more recommendations on how to avoid common data collection errors on fertility questions, please refer to the brief on select topics in international censuses, measuring fertility from a census, found on our website. You will find a link on our course website. To summarize, data collection is key to producing quality pregnancy-related and maternal mortality indicators. It is best practice to try to minimize errors during the data collection stage. It is important to train census takers to ask all questions verbatim. Many errors occur when census takers do not ask all the questions and do not ask them verbatim. Misreporting in deaths or births will result in unreliable or inaccurate estimates of pregnancy-related and maternal mortality indicators. Once data have been collected and processed, the data will need to be tabulated. In the next episode, we will discuss what tabulations are necessary for pregnancy-related and maternal mortality estimation.